Dr. Smith, physical therapist here, and this video is going to cover why healthcare is so broken in the United States, how it got to be so fucked up, but also what we can do to make it better. We know that this has been a calling for a lot of us that are providers or students that has really turned into an oppression through a multitude of factors I'll list below. But most importantly, it's affecting patients, and we're getting worse outcomes because everything just dies when healthcare is run like a business. And it never used to be run this way, but when business workers retired in Congress or became heads of insurance companies and lobbied for medicine to be run like a factory, this is the current outcome that we have. We've seen the death of one-on-one patient care, where now even patients feel like they're in an assembly line across all settings and practices, no matter what it is that you do. Yet, insurance wants outcomes, but they also want you to see as much as possible for as little as possible so they can maximize reimbursement, and sometimes you have to do that so you can stay afloat and not go bankrupt. It's been proven time and time again that over-medicalization is not good care, and what that means is that the more you see somebody, that doesn't necessarily mean you're going to get better. If you see someone 3 times a week, 15 minutes a week, you might get a worse outcome than just seeing them once for a full hour and totally understanding them and connecting with them. Another huge problem that we're seeing, leading to a lot of highly educated individuals commit suicide, is the rising cost of tuition and student loans with stagnant salaries or decreasing reimbursement costs. And again, whether you're a PA, a physical therapist, a nurse, a physician, you went into this profession or your profession to help others. You sacrificed financially, emotionally, you probably went through relationship drama, financial drama, and so on. And you sacrificed so much. And you get out to the other end, you're not being used the way your license allows, the way your education allows. You're being used as a machine that generates money for something that controls you, and you have to be controlled by it because you have student loans to pay back. And I'm pretty sure that the system was purposely designed this way, because when you don't have financial independence, you can't say, no, fuck you, I'm independent and I'm going to do my own thing. So I'm pretty sure that was actually purposely built in there, because when you think about it, there's no other place where you can just walk in without proof of income and take out a loan. Even payday loans, you need proof of income. As I stated before, decisions made by non-clinical staff, such as retired factory workers, retired lunch ladies, people that have no clinical license, no medical background, or maybe 1% of them does, no one listens to that person, are making medical decisions for everybody else. To me, anybody that has passed a law or voted on something that affects something in medicine should be charged with practicing medicine without a license, because how can you make decisions medically or understand payment or understand what is needed or what's best for each person or each case or each diagnosis or each disease when you don't have the clinical education or a license to even practice? Another thing that we're seeing that I actually experienced myself in PT school, and I've seen it happen in medical schools, and I've seen it from my friends in medical schools that reported to me, and I've seen it happen in nursing school, and I've seen it happen in the workplace, is that there's no punishment for hazing. No one's held accountable for being a piece of shit. So in professional programs, cliques are formed, and people are made to feel less than others by getting a lower grade. People have been made fun of for getting, like a C on the test, when a lot of people got A's, and it's just this culture of like, I'm better than you, and instead of lifting someone up next to you, you're always tearing them down. And I just don't understand it, because at the end of the day, we're all in this to help others. We're all in this to be part of a team that works efficiently to hopefully burn this fucking system down, or at least fix it, and ultimately get the patients better outcomes, and patients don't feel like they're in an assembly line. And like I said, that can be attributed to bad parenting as well. But, those same parents supported the system that's super fucked. I already touched on this. One thing I will say that we've seen, actually across all the healthcare field, is that we've seen the requirement for education to practice to go up. We'll look at physical therapy for an example. where it was a bachelor's degree to now it's a doctoral degree. You might have a physical therapist with a bachelor's degree who only does lower extremity exercises get offered more money than somebody with a doctorate because they've been practicing for 20 years only doing lower extremity exercises, when the person with the doctorate can do med rec and so on. But we've also seen this with some of my friends who are physicians who finished their residency and they're being told they're not going to get paid as much because they don't have as much experience as they just finished the fucking residency in 4 years of medical school. And again, the system is ultimately run by insurance companies and those in Congress with no background, as I stated. And I didn't mention this in my prior videos, but I'm going to mention it in this video. I know with PDGM and PDPM hitting PT, and a lot of PTs that are my subscribers, you want to pay attention to this too. But my theory is ultimately it was purposely done to decrease therapy so that lawsuits go up and rehospitalizations go up. Because when people get less therapy, they're going to get worse outcomes. The facilities are going to get shut down, they're going to get sued, but that Medicare doesn't have to pay that money, the facility has to pay the money. And also when these rehospitalizations go up, they won't have to pay the hospital as much money or no money. So I'm pretty sure it's a trickle-down plan. Like the whole plot is to start with therapy, but have these patients get so bad that it trickles down into acute care and other payer sources that Medicare can be like, oh, we're not paying for this because you didn't do your job, when it all started by cutting therapy. Also, those that don't pay for healthcare are abusing the system. Like I have patients who are basically just lazy and they use their healthcare because they can. I've discharged them for non-compliance, and some of them probably should be on hospice or not be getting service at all, but they have healthcare, so they use the system and they don't pay for it. So we're subsidizing a system that's abused and wastes billions of dollars, and that's why I think Medicare for all is a terrible fucking idea, because if we're already wasting billions of dollars, we're going to waste so much more, and more people will have to subsidize the system, and it's just fucked. So what's the solution? Well, we can burn it all down, which is probably the best bet at this point. But when you burn it all down, you should erase everyone's student loan. You should let everyone start fresh because, as I said, the system is just predatory, where you can never really be independent if you went to school to help other people, because the cost of education for doctoral degrees, where now almost everything is a doctoral degree or a master's degree, you're going to have, that undergrad debt, that graduate degree debt, or that medical school debt, and so on, or extra debt acquired if you're a resident physician. And it's going to get to a point where it's just not sustainable, or we're going to see more and more people end up killing themselves, because that's the only way you can get out of this right now, is that you either pay it off or you kill yourself. You can't discharge it in bankruptcy, and it's amazing once you actually learn all about it, how fucked it is. So, you can burn it all down, erase everything, start fresh. Only have clinicians lead the way, as long as they're not the piece of shit ones I mentioned earlier, who are like hazing classmates and just being complete pieces of shit to other people. Again, this is about teamwork and collaboration. And, we can build it up with clinicians leading the way. One thing we can do, though, that might, send a message would be to stop providing treatment to all except those who are critically ill, because companies will freak the fuck out, because that will stop the billing cycle. If you want to make noise, cut off the money source. If everyone's like, well, I can't bill an extra $50,000 this week because my ancillary services or my nursing service or this isn't doing care this week and the patient's not critically ill, then, that might be the best message to send, is we're not going to fucking do this, because they can't hire anyone else to do it. And they might try to hire someone else to do it, but hopefully if everyone stands together and nobody goes and takes, a strike job or anything like that, it would actually be beneficial. People have done this multiple times, and usually what happens is they offer someone to come in to be someone that goes against the strike for extra money and so on. We see this a lot in the travel community when there's strikes in California. But ideally, it would be that everyone just stopped except critically ill, and that way the billing would be at a freeze point. And that's the only way to really make change, would be to freeze everything except for the critically ill patients, because we don't want to make patients get worse. We want patients to get better, but we want to send a message to the system. You can get investors to help lobby against the insurance companies. Providing value, isn't enough. We're looked at as money in everyone's eyes again. We're the factory workers. Our patients are what we produce, as in revenue dollars. You can also just walk away and do your own thing. Be an entrepreneur. that's honestly the way I think that everything is going to go. And where we still see one-on-one patient care is in entrepreneurship, one-on-one cash pay practices. So in that way, you just wipe your hands of the system. No more insurance, none of that. And it's gonna completely. The system is so fucking broken right now that I honestly don't know how to fix it besides just walking away from it and just letting it just burn. But it's self-imploding. And honestly, I think though, like I said, the best way to fix it is to send a message that if they can't bill for services under someone's clinical license because everyone takes a step back, that's really the only way our voices will be heard. Or you can get to a point in leadership where you can be a governor, mayor, senator, president, etc. And at that point, you have more of a voice at the congressional level. You have to understand policies, understand insurance, and so on. That's actually something I've considered myself. I just don't know how to do it. I know that I'd probably be the only person running with a doctorate and a master's degree in public health. So they probably hate me for being a science guy. But that's really it for right now. Hopefully this gives a bit more insight into what's really going on. I didn't cover it completely. If there's anything else you want me to cover, please comment below. If you have any comments, complaints, questions, or concerns, comment below. Send me a message. Reach out to me. Again, I'm Dr. Smith, physical therapist, and I appreciate your time watching this video. Subscribe to the YouTube channel if you haven't. If not, no hard feelings. But again, hopefully this sheds some light on what actually is going on in healthcare.